Oh, okay.
Hi, everybody. I'm so happy to introduce such a great teacher and practitioner, Nigel. He has such an international presence, and I am so honored to have Nigel today. Thank you, Nigel.
Yes, thank you. Hi, everybody.
Hi. Please tell us how you started shiatsu, acupuncture, or martial arts, and
Yes.
you are involved in this field for so many years. What keep you going?
Oh my goodness, so many years. Yeah, I feel old already. That's it's interesting. The beginning of my story is very sometimes quite different to a lot of my friends and colleagues. For example, many people I think uh, sometimes come into our field through illness. Actually, if they get sick or and they get treated by somebody and they have a success story and then they become interested. That's one way. Many other people have a kind of connection with some kind of chi or ki activity, like martial arts, like you say, or kind of those kinds of things. I didn't have any of that. I was I was a graduate in comparative literature, something very different, kind of intellectual thinking, all of that kind of stuff. And I just was thinking at that time, I was probably 21, I guess, to continue my studies in the graduate level, like a PhD or something. But one day I woke up in England and I thought, I don't really want to do that. It's just too much in my head. I want to experience something different. So I just started to plan some travel, like a lot of young kids of that age. You want to travel, right? Leave university. So I traveled and I wanted to go as far away from England as I could, something very different. So I began to form an idea to go to Asia, East Asia, because I was very interested in Chinese culture, actually. I didn't know very much about Japan at that time. And the short story is basically that in I guess it was 1983, something like that, um, I intended to go to China, but it was very difficult to get into China at that time. And in fact, I discovered that you could only really be part of a kind of formal government sponsored kind of trip, and you couldn't really work there, and you couldn't really, it was very difficult to penetrate the Chinese culture at that time. So somebody said to me one day, "Why don't you go to Japan? Why do you go to Japan? Look, Japan, 1980s. Oh, the economy is very strong. They love English people. You can teach English. You can, I thought, okay, not a bad idea. So my story is a strange one because I arrived in Japan with no plans and no intentions, just very open, looking around, meeting lots of gaijin foreigners, because there were not that many actually at that time. But the ones that were there, because Japan was quite expensive culture to live in, it was not really like a backpacking thing. Like, foreigners were not usually going to the beach and just hanging out. They were usually studying something Japanese, like martial arts or ikebana or some kind of cultural aspect of the Japanese traditions. So, sure enough, I met lots of people. And again, to cut a long story short, I ended up in an acupuncture class
Ah,
through one of my good friends, and I was like, "Oh, this is sort of interesting. Maybe this okay." So again, I didn't really have a plan at that point, but I just started to follow that school, and through that school, I met a shiatsu teacher by the name of Suzuki Takio, who had been a student of Masanaga's, and actually Suzuki was originally appointed by Masanaga before he died to take over Iokai, and he did that. Without getting too political, there was maybe some slight disagreements between him and Masanaga's wife, who survived him, and so he left Iokai and then started teaching privately on his own. So me and some other friends, we teamed up and because his English was not that great, but we had friends, two of my friends who had very good Japanese. So anyway, long story, I was doing acupuncture school, and then I was studying shiatsu with Suzuki separately, privately, for about 5 years, I guess, in the time I was there. And I was also introduced to Kampo studies at that time in the school. So that was my rather unusual angle into Toyo Igaku, or East Asian medicine. No plan, no sickness, no miracle treatment, no history of martial arts, nothing. Just fell into it, and but I love it. You know, that's my life. I just didn't really change my direction from that time. Um, so
What do you like about it?
I like the freedom of decision making.
Mm.
um, which for me is I don't I have never worked for anybody. I think I would
Uh,
be a I think I would be a terrible employee. I'm sure I would not I'm sure I would not behave well if I was had a boss or something like that. So um, I like as a profession I like to have that freedom. But the substance of this profession is much more than that. It's a kind of lifestyle, you know. I think we all would agree. It's not, you don't wake up in the morning and think about a job. You wake up in the morning, think about your patient, and it's about personal relationship, and it's also about your own personal development. So I like the fact that your job, as it is not disconnected from your life. It's part of your life, and it's the way that you live your life, hopefully, in respect of understanding ki, understanding energy, understanding movement, and blockages and illness related to blockages and stuckness. So this kind of movement and freedom is rather important in health, I think. So that's what I like about it. But I like the personal relationships too. I love private practice. Um, I do teach quite a bit, and I love that too. And I always love working with students. But I particularly like working with patients because it's a very intimate, personal engagement with someone about their health, and you know, I regard that as a kind of a privilege in a way. If you can end up helping someone a little bit, feels good, doesn't it?
Definitely, definitely. It's a special, it's a gift. That's what
Yes.
we say. Such a wonderful profession. It's, yeah, like you say, it's a privilege. It's wonderful. So I want more people to understand our profession and then go into our profession, because so many people, especially now, so many people are suffering emotionally and physically.
Yes.
And if we can help as many as people as possible, we need more people to understand philosophy, understand uh, Oriental medicine. So please tell us how you involved from learning the Japanese culture and then learning all the Shiatsu Kampo from great teachers in Japan, and where did you go from there?
I know
Yeah,
it's an
such a
interesting
big step from
interesting
Western
transition.
culture to Eastern culture.
Yeah.
You
Yes.
breathe, you eat, and then you stay there for five
Yeah.
years. That's a big
Yeah.
chunk of your life.
Well, it is a big chunk, and even not counting the years, in terms of the impact on my life, I think it's very profound.
Mhm.
I even today, all these years later, I think about Japan and my experience there almost every day, and how it affected me. I can't really put that into words in a very simple way. It's so many different levels, but and I'm hesitant to idealize the Japanese culture. I try not to do that because every culture has its strengths and its weaknesses, and we all have that. But there were a lot of things in Japan that I did discover that were just really very beautiful and very powerful for me, like the interrelationship with individuals. Once you could get past the superficial barrier of, which I was very actually used to because I'm English, and we have that in England a little bit too. We're a little bit kind of formal, and it takes a bit of time to break the ice and come inside, you know. And Japan is even more like that, I think. At least my experience was like that. That it took time to make a friend of a Japanese individual, but once you did, it was a very beautiful thing because there's such a lot of attention to detail in daily life, and the small things become very important. And the attention to those small things in life kind of add up to something very beautiful. I think it's my friends, my Japanese friends, didn't tend to philosophize very much or talk about big things. They just, led their life in a very simple but very clear way. And I learned a lot from that, actually. Also, this group thing, this kind of the wa, that kind of harmony idea is lived in Japanese experience a lot. Like they love to be in groups and share things and be very social. And again, that was something that I really appreciated and learned. And then naturally, of course, there were so many physical experiences in Japan that I had never been exposed to. So I studied some martial arts for a little bit in the actually Aikido, so in the Aikikai in Tokyo for a little bit. I'm certainly not a very proficient martial artist, but I enjoyed my time with Aikido. I learned to fall down a lot. That's what I remember. and um, and I did get quite into my Zen studies also. So I was studying Zazen, and I had a teacher in Kamakura when I moved to Kamakura for the last 2 or 3 years of my time in Japan, and that was a very profound influence on me, even until today. So learning to sit and learning that kind of intensity, yeah, was super important for me. Um, Gosh, someone just buzzed me. Maybe I'll ignore it. I don't think I'm.
So Nigel, that's very, very interesting story. So tell us the difference between Japanese acupuncture and the Chinese acupuncture. What is the specialty about Japanese
Okay.
acupuncture?
Well,
Kampo.
I'm glad you found the story interesting. We didn't get time to finish it, but that would be for
Oh,
another
yes,
day.
that's right.
My
Yes.
my shiatsu school in London, and then coming to New York, and yeah, all of
Oh,
that stuff. But
yeah.
that's okay. Japanese, yes, okay. Well, the history of transmission of Chinese medicine, medicine from mainland China, um, and that in itself is an inaccurate statement because I don't think we can imagine that all of Chinese medicine was transmitted into Japan in one go. That would be ridiculous. It's such a huge country, and there were so many different forms of the medicine practiced by many different kinds of practitioners. Of course, we're all familiar with the major disciplines, including acupuncture. So, herbal medicine itself, acupuncture, shiatsu, and different kinds of body work in China. These days, it's more Tuina, but it used to be Anma, the Anma system, which transmitted to Japan, of course. Do-in Ankyo, that whole system of exercises and massage therapy and so on. So that transmission began, I think everybody knows, in the late 6th century, somewhere around 580 AD or so. And usually it was mostly transmitted by monks, visiting monks, and religious scholars, and they were usually quite well trained in all of these medical and martial arts usually. So that began a whole stream of transmission from the mainland in China into Japan, and that included acupuncture, of course. Um, but the Japanese culture, being its own culture and having its own history, naturally imprinted itself on this transmitted material from another culture. And although the basic things remain the same, in other words, the attempt to, usually from the pulse, uh, assess imbalances in the flow of energy, just like we do in shiatsu through the abdomen usually. So with acupuncture, you're assessing the same kind of kyo and jitsu, of course, but also some other aspects of pathology, and using the tongue and other diagnostic indicators as well. So that all remains the same. There's no major differences there. And the aim of acupuncture in balancing the flow of energy in the meridians, which again is very similar to shiatsu, that aim remains exactly the same. There's no difference between Chinese style, Korean style, Japanese style. But the things that started to appear and manifest differently, I think, have a lot to do with the Japanese character because, and I make the parallel with Westerners in the modern times when we started to receive acupuncture into our culture. each culture is different, and particularly if acupuncture is not a part of your own culture, it's something a little foreign, a little bit unusual, right? Like most Western patients in England when I was there and in America, many of them don't really know what it means to have acupuncture, and they're a little bit nervous sometimes. So, one of the things that I think happened in Japan is that the Japanese patients identified with the idea of regulating energy. That was not new to them. But they didn't necessarily like some of the techniques that were coming from China. They found them perhaps in their own sensibility, maybe a little bit hard or harsh or strong, let's say strong. I'm trying not to be critical. I'm just giving a sense that
Right.
uh, why did the Japanese, for example, um, use finer needles? They decided to use finer, thinner needles, and some of the techniques, or many of the techniques, became more gentle and subtle. Um, is probably because of the Japanese character of the patients. So patients would not tolerate such strong treatments as they were giving in China. For example, I think that's very true because I myself, after I left Japan, I went to China for 6 months and I studied in the hospitals there. And the kind of acupuncture style that I saw in the hospital was almost shocking to me because it was very strong and very intense. And patients were like, "Oh, if I don't feel the qi, then this acupuncture is not good," right? That was the Chinese approach. I must feel the qi, almost to the point of pain. But in Japan, I had learned very quickly that if you cause the patient pain, they don't come back. so, so this is a very different focus on the intentionality of the experience of the patient. So I'm not talking about your clinical aim or what we're trying to do with the treatment, but the experience of the patient is appreciated very much in Japan and considered as important, very important. So in China, I'm not saying that they disregard the patient. I'm just saying that the doctors are more focused on this is what I want to do, and the patient has to kind of tolerate it. That's the kind of approach.
Oh, I
So
see.
it's a little different, and so that in China the needles are bigger, the stimulation techniques are much stronger. They The patients expect to have a certain level of discomfort that should be tolerated because that's part of the process, that kind of idea.
Oh,
In
I see.
Japan, in Japan, they don't have that idea at all. The patient expects to have a kimochi ga ii, like a nice feeling, a comfortable feeling, and therefore, over the many centuries, the Japanese developed a lot of sensory techniques where there was a lot of focus on in Chinese they call it qi dao, the way the kido, the way of qi,
Right.
meaning that in the training there's a lot of emphasis on what the practitioner themselves feel as they needle. Instead of, for example, focusing on what they call in China the de qi, which is the arrival of the qi as an experience for the patient. So in China, for example, they often stimulate until the patient says to the practitioner, "Oh, I feel it, I feel it, I feel it," which is yeah. In Japan, they don't rely on that in the techniques of acupuncture. It's much more the practitioner themselves. If you have a sensation of the echo of the chi or the ki moving, that's it. We're done. Even if the patient does not feel that, that's okay. The practitioner feels it. So the experience overall as a patient is much more gentle, much less invasive, I should say. Um, and I'm not talking about efficacy. There's no question that there's a lot of very good treatments in China, and I saw many amazing treatments. I'm not talking about what's good or what's not good, but it is a different style, it's a different experience and there's a different focus in the practitioner, I think, in between China and Japan. And Japan, the focus is on their own sensibility of the arrival of the key for the practitioner and
Mm,
also on the very careful interplay between the practitioner and the patient. And your aim should always be, or I was taught anyway, was to include the patient in a kind of comfortable kind of experience and not to do anything that's too aggressive or abrasive for the system, because these techniques will ultimately maybe disturb the key in a negative way. So, yes, there are some some major differences in both the approach and also the technical aspect of acupuncture in Japan and acupuncture in China. But of course, part of that is also due to the setting, because the setting is so different. Much of the acupuncture in China in an urban area is delivered in a hospital setting. So for that reason, it's a little bit more short. The doctor doesn't spend so much time with the patient. There are many, many, many patients coming and going all the time. When I was there, for example, we used to see about 50 patients before lunchtime. I mean, it was very, very busy. And there are a lot of assistants helping the doctors and all that. In Japan, of course, it tends to be private practice like it is in the United States, whereby patients will come one patient, 1 hour. The practitioner has a lot of time with those people. And so the setting is also very different, I think, between the two systems or the two cultures. Yeah.
Good point. And how do you describe acupuncture in UK?
Well, I think I was lucky because I came back to UK in a time where acupuncture was just beginning to, people were having an
Right.
interest. It was like, oh, that's like, at the end of the 1980s. And so I was lucky enough to, be there at that time and started a practice. And not many people were doing acupuncture then, but the ones that were tended to, people knew about you and they came and we had patients quite quickly. And at the same time I started to teach also and began a school of my own there. So I was quite busy quickly actually in England. um, and that was on a personal level. I was very happy because my father thought I was completely crazy when I went to Japan, of course. He was like, "Oh, you're wasting all your very good education, and you should be going to do graduate studies in university, and then you get a very good job in the government or something like that." And so when I went to Japan, he was not too happy. But within 1 year of coming back to England, I was quite busy, both with my patients and also teaching at the school. And I was happy that my dad he kind of came around and he said, "Oh,
Oh,
this is kind of interesting. Okay, good. All right, fair enough." So that was a good story for me.
oh, I see. I see.
Yeah,
Huh.
because because I suppose you would say what I did was not very traditional. I had a very traditional education. I should have become a lawyer or a banker or a something like all my friends, but I didn't want that. So at the
Mhm.
time, that was kind of, I suppose, countercurrent. My
Mhm.
but in the end, it worked out. So
Great. That's
yeah.
great. Yeah. So tell us, what are you gonna share? What are you gonna teach on Saturday, April 9th?
Well, that's a good question because
Yes.
I keep changing my mind about that.
Yeah, you
Well,
because
um,
you have so much to offer, it's hard to choose.
well, it's an informal setting, and
Yes.
I understand that it's all online as well. So I'm just, I think what I'll do is I
Mhm.
would like to, I would like to maybe share a few things about Fukushin, about abdominal palpation. And
Mhm.
so, if I can organize it, I will ask my girlfriend to be a model, and
Mhm.
I will do a little bit of demonstration of the particular Fukushin sequence that I use, usually in Kampo. So, this
Mm.
particular this particular sequence is more useful in getting information that kind of helps me make decisions about herbal medicine, actually.
Mm.
But I can also make comments about the findings that may relate to energy medicine or even acupuncture or shiatsu also. And some aspects of the technique, absolutely, I learned from my shiatsu studies. So um, many times in the Kampo practice, uh, I would say, possibly, hopefully I'm not being too critical, but sometimes the medical doctors in Japan, they don't always learn or a great focus on technique and actually learning how to palpate the patient in the abdomen. They definitely learn Fukushin, and there's a sequence that they use, but it's often very kind of staccato and a little bit not flowing. And
Mm.
so I've developed my own style, which is very much based on my shiatsu, studies. and practice. So I'd like to share that in that context. And I won't be talking about herbs. I don't think that's relevant necessarily, but I can make a few comments about the kinds of things that, those findings might represent, or what I might be thinking about that. So yes, I'll make the abdomen the focus. Maybe talk a little bit about the history of, why the abdomen, why the hara is so central to the
Yes,
East
yes,
Asian culture,
yes, yes.
that kind of thing, which
Uh-huh.
I think is not a surprise to anyone, but I think there are quite a lot of cultural connections that are terribly important to grasp
Yeah,
as to why in shiatsu and acupuncture and herbs, why do we always go to the abdomen,
oh,
for,
yes.
it's those things are important. So yeah,
Great,
that's
great.
what I like to do. Yeah.
Wonderful. Looking forward to it. Thank you, Nigel. Thank
All
you so
right. Thank you very
much.
much. Yes,
Thank
of
you.
course. Yes. Nice to see you and look forward to it.
Wonderful.
Okay. Bye. Hi, everybody. And I would like to invite you very much to join me on April 9th on the Five Lights Center website, I guess, for this short presentation of a mixture of talk and practice. I'm going to do some demonstration on a particular style of Fukushin or abdominal palpation that I hope will be interesting to you. I'm very thrilled to be invited by Kumiko to, offer some of my own experiences in the use of the abdomen in practice, and I hope you'll enjoy it, and I hope you'll come, and yeah, let's explore these things together. Kind of fun. See you then.
Great.